of our conversations. When you check your time, you see it's 19 minutes past the hour of 12 here from our studio, and it is a very beautiful day, a very beautiful afternoon, I must tell you, and a very beautiful way to say welcome to the issues today. Today will not be an exception as we tend to focus on another very interesting conversation. At the same time, I should say a healthy conversation for those of us that are conversant with the issues. You know that every Thursday we have the opportunity of bringing into the studio a guest from Ikorodu General Hospital, where they help us enlighten the general public on activities around our mental health and every other necessary information. Today, of course, again, I have the honor of having in the studio a renowned doctor, a personality who is well good with her onions and knows her job so well. In the studio with me is no other than Dr. Kehinde Osinaike, who will be doing justice to the conversation this afternoon, pardon me. Do not forget that today happens to be the World Tuberculosis Day 2022, and we have done a lot of justice to that earlier today. If you missed that, I would say sorry for that. You could perhaps check on our website or you go down to our social media platforms to learn from that. Do not forget that we have a pending conversation from the 20th of March 2022, the day that was set aside for a day for the dental health and oral hygiene. And today the conversation would still continue in the studio, and that is why I have a consultant family dentist, no other than Dr. Kehinde Osinaike. So I say good afternoon to you, Doctor.
Good afternoon.
How are you doing today?
I'm very well, and you?
Very well too. I must say you're looking all good.
Thank you.
It's good to have you in the studio.
Thank you. I'm glad to be here.
Yeah, that's the voice of Dr. Kehinde from General Hospital. She happens to be a consultant and a family dentist. Like I told you earlier, she knows her onion so well and she's doing just so fine for herself. Do not forget that you can join us live on our social media platform on Instagram and of course on Facebook, where you can watch us live and perhaps see the beautiful face of Dr. Kehinde Osinaike. Check us on Instagram at IKD1061FM. We are live and direct, and of course you can hear us all over the world via our website www.ikd1061fm. Today the topic right in front of us for focus is dental health and oral hygiene practices. Without further ado, I would like us to dive into this conversation. So Dr. Kehinde, when we talk about oral hygiene, everybody feels or have the mentality that it is just to brush your teeth in the morning, wake up, brush your teeth, and then perhaps not even everybody, few will come back at night and still try to do same. So let's start this conversation on a very soft note. When we talk about oral hygiene, what does the word oral hygiene mean?
Okay, first of all, I would like to say that oral means, oral is like a professional way of saying the mouth.
Okay.
So anytime you hear oral, it's actually the mouth.
Oh, okay.
So when we talk about hygiene, we're talking about the cleanliness.
Okay.
So oral hygiene is the cleanliness of the mouth. Okay. So what are the things that you do to make sure that your mouth is clean? So that's just, I'm putting the two words together and then giving you the definition of oral hygiene. The things that you do to make sure that your mouth is clean.
Okay, thank you so very much. So sometimes ago, United Nations alongside World Health Organization came up together and focused on the 20th of March that this should be a day set aside for such a conversation to orientate the general public. This also happened on Sunday, but unfortunately we could not have you, but it's good to have you here now. So first of all, I would ask, when we talk about General Hospital in Ikorodu, we know you guys are doing so well, but for this year's World Oral Day, what were the things that were put in place to orientate the general public about oral hygiene?
Okay, as we usually do for the World Oral Health Day, so it is WOH Day.
Yes.
So what we normally do is we try to educate the public, about their oral health. Remember, I said that oral health means, the health of your mouth.
Yes.
So we try to do that every year. And so what we did this year was that we went to various departments, because we have the GOPD, we have the MCC, we have people that come for different things in the general hospital, but not for dental. So what we did is that we went there, we had like a rally there, and we had oral health talk, which was given by the hygienist. So yes, you came for maybe MCC, you came to see them in the MCC. So we came to discuss how would you take care of your teeth, how many times do you brush, how many times do you change your toothbrush, so it was generally an awareness.
Okay.
Yes. And then yesterday we also went out to Agbala. We went there to, the environs, to let them know that you need to take care of your teeth. And so the what oral health day is actually basically awareness, because the honest truth is that as we are now, still so many people are not aware about their oral health. Still many people are not aware of how to keep their mouth clean. You still have people that they will come to the clinic and they'll still say we brush once a day. Exactly. And it is everywhere that you should brush at least twice a day, in the morning and at night. So these are the things that we did, and of course we gave out cleaning materials, just to encourage people.
All right. You've heard Dr. Kehinde with that conversation. We're going to dive into this conversation real good now. You know, you saying that you did all of this orientation, I am tempted to ask, when we talk about this WHO Day, that is the World Oral Hygiene Day.
Oral Health Day.
Oral Health Day. Now, one thing people don't really know is the essence of this oral hygiene. Like I said earlier, it is just for me to wake up in the morning. It is a norm for me to just brush my teeth and go. Some will tell you there's no even point brushing at night. Next morning, I will do that. So I would ask you, what is the essence of oral hygiene? Is there any necessity for it?
Amazing. That's a wonderful question. So I would like to start with saying that the mouth is the gateway to the body. And the mouth is the mirror of the body. So anything that goes into the body, we know will most probably go through your mouth. And so if your mouth is clean, if your mouth is dirty, that means you are taking all the dirt into your body.
True.
Right?
Yeah.
And we know that our mouth also contains some bacteria which are normal, which should be there. Normal flora that should be there.
Okay.
But if you don't clean your mouth, of course you have some bacteria that should not be there. And so once those bacteria are there and you eat, you take those bacteria into your mouth. That is explaining that the mouth is the gateway to the body. Now, the mouth is the mirror of the body. That means that there are some things that you see in the mouth that will let you know what is happening in the body. So sometimes we have patients that come to the clinic and we have them we just notice that they have so many teeth that are shaking.
Okay. And
so all those teeth are just shaking, and then that raises a red flag that something must be happening in this person's body. And so we send them to go and do their sugar test. You know, they do their fasting blood sugar, and by the time they come back, you find out that these patients, most of them, are diabetic.
Wow.
Yes. You have some patients, they will come in and say, oh, I've been having this ulcer in my mouth. It comes and it goes. And by the time you question them further, you find out that this patient is probably under stress. For some patients, they come out they have some, growth in their mouth. I don't want to use too many medical terms, but you have some places that will be, you have some white patches, you have some red patches. By the time you probe further, you find out that these are the early signs of cancer. So that's why I say the mouth is the mirror of the body. So there are so many things that are happening in the body and that would probably first show up in the mouth. And there are so many things that are happening in the mouth that can also affect what is happening in the body. Either make it worse, or something like that.
Oh, okay. With this that you have said, I would want to ask, I'm tempted to ask that, could this mouth infections and all of this, if there are any times to that, could it be hereditary? Because some would tell you that, no, just leave me like this is how it is in our family. This is how we pass through in our family. How true is that statement?
Yes, we have many patients that come and say, oh, every member of my family, we all have this, especially when you talk of caries, which is one of the most common, dental issues that we have. That's when you have, in a layman's language, you have holes in your teeth, you have cavities in your teeth. The patients will come and say, oh, so what? I will not really say they are hereditary.
Yeah.
I'm talking of caries. I would say that, well, yes, it's hereditary, but I would also say that some families are prone to have these things. So also cancer. You have some families that are prone to have it. So what you do for those patients is that you try to remove the risk factors, because there are always risk factors for every health condition.
Okay.
Yes.
All right. let me cut you there. So when we talk about our mouth, so many persons will be surprised right now. Like Yorubas will say, "Shua letoyan." Is it not just this mouth? Is it not just for us to brush our teeth? But keeping one's mouth clean and free from disease is actually very paramount. Is very important, and it's key. No doubt about it. Statistics shows that a lot of persons are suffering from different mouth diseases. That came out from United Nations and World Health Organization sometimes ago, 2016, and we had one in 2021. That was last year. With all of the statistics, we know that oral hygiene has a poor general awareness. I would ask, what is the major problem to poor information on oral hygiene? Not everybody is aware of all of these things.
Yes, and I think that is why now we dentists are pushing harder so that people are more aware about the state of their mouth.
Okay.
And so that's why we also advise patients to come and visit the dentist. Whether you have pain or you don't have pain, try and come to the clinic, because there are some things that you will not know that are happening in your mouth before you actually take a mirror and say, oh, let me look at my mouth. You know, it's hardly that you would do that.
True.
You know, it's only probably when you are, but we also realize that most patients only come to the clinic when they have pain. You know, but the thing is that there are things that can be done to prevent you from having this pain. So if you don't visit the dentist, then you only come when there is pain, and most of the time, by the time you are coming, it's already really bad. You know, so, and that's why the things like the World Oral Health Day that we do, and then we also have school sensitization. We go to schools to sensitize the little ones, you know, telling them about how to take care of their mouth, you know, and all these things. You know, so these are all the things that have been put in place just to increase their awareness, you know, in our citizens. We also have people that, some of us also go to the marketplace just so that people are aware. And yes, it has increased, but we're not there yet. We're not there yet, and I think this is why we have a program like this as well.
Exactly. Dr. Kehinde is still in the studio doing justice to the conversation, talking about dental health and oral hygiene practices here on IKD 106.1 FM. Do not forget, like I told you earlier, you can hear us from all over the world on our website, www.ikd1061fm.ng. The conversation continues. Now, there are symptoms to poor oral hygiene, but most of all is that of bad breath. So naturally, when they just see that a person has this bad breath, they just feel like, he has the problem. What are the other symptoms with clarifications to oral hygiene? What are the symptoms of, aside bad breath? We know that bad breath is the most common of all. Are there any other thing that we could still look at when we talk about dental side of it?
Oh, definitely. So those are the signs, actually. Those are not symptoms.
Okay, signs.
Signs are the things that I would see. Okay. Symptoms are what you are feeling.
Exactly.
All right. So we have so many
signs. Okay.
Yes. So one of them, of course, as you said, is bad breath, which is called halitosis. But something that is even commoner than bad breath is dental caries. So yes, remember I told you that we have normal bacteria in our mouth, and we have many of us that eat lots of sugary things. And what do we eat? Even we as individuals, what do we eat? We eat a lot of sugary things.
True.
And when we eat all these sugary things, what happens? Acids are produced. So also when bacteria, of course, bacteria in our mouth have to feed. And so they feed on the sugary things that we eat, the leftover that we have in our mouth. And what happens? They produce acids. And what do acids do? Acids destroy. And so when you have a buildup of acids in your mouth, they destroy your teeth. And so that's how we now come up with holes in our teeth. Some people are more susceptible because, and of course, the kind of food that we eat also makes us more susceptible. You have people that eat lots of plantain, especially the very soft one. When you eat that, it sticks to the surfaces of your teeth. You know, and most of us will not brush after eating, and we will not brush at night. You know, so that is one of them. Now, when dental caries has become so bad, then you have what we call some worse pains. Some people will come down with dental alveolar abscess. You know, those are, you know, that's an infection that has gone beyond just the surface of the tooth. It has gone down into the roots.
Wow.
You know, and it has gone into the pulp. Then some of them will now have, you have patients that come with bigger swelling. You know, I'm trying to just use too many medical terms.
Yes.
You know, so you have all that. So they come with that. Then you have another thing you call periodontal disease, because what we can see on the surface of our tooth is just the crown. There's also a lot of things that are happening under. So we have the periodontal tissues. That's where you have the roots. That's where you have the ligaments. So all those things, once they get affected, then you have some, and then you now find out that patients will just come and say, oh, this tooth is shaking. A tooth that is just shaking, you know, it just starts shaking on its own like that. There's an issue. You have a patient that comes to you, and the patient is bleeding. You're bleeding when you brush. So when you brush and you are bleeding, that means that you have an issue. There is something happening in that mouth and it has to be checked. So we have all that is happening in the mouth, amongst other things.
All right. Okay. We would look at another side of this conversation, but do not forget that you can reach out to us on our phone lines 0904 081 1061. If at all you need to speak to a consultant or a family dentist, Dr. Kehinde Osinaike is in the studio. She would attend to all of your questions. Still moving ahead, how true is this? I would like to ask this question. When we talk about all of these signs, I'll take in the calls. You guys still need to hold on. When we talk about the signs that you talked about, not symptoms, is it true to say that they show up more in the older generation, older persons, than the younger ones? How true is that? Or the younger ones also suffer from all of these signs?
Oh yes, both the old and the young suffer, but there are some things that are commoner amongst the older people.
Okay.
Of course, we also know that as we grow older, our immune system is not as strong as before. So that's why it seems as if you are finding it more in the older people. And of course, you also know that in the older people, they have more comorbidities. They have hypertension, they have diabetes. So all these things are reducing their immune system, the ability of the immune system to fight. But really, we have all this across board. But because there's a reduction in the activity of the immune system, you find out that it shows up quite a lot in the older people.
The older generation.
Yes.
Oh, okay. So let's take this conversation down to how important is it for oral hygiene? Because when you look at every part of the body, one of the most important part of the body is the mouth, just like you said. But yet people take it for granted. Some would rather prefer to focus more on their eyes, their ear, their nose, and other parts of the body, and they just feel like the mouth, the highest is to get a toothpaste and a brush. I will take care of that. So how important is oral hygiene to mankind?
Oral hygiene is very important. Remember, I said that mouth is the gateway to the body. Whatever is happening in that mouth is going to affect the body. So it is very important, and it goes beyond just brushing your teeth. And the reason why I want to assume that, for example, somebody will probably want to will concentrate on the eye. Because once you see somebody, you see the eyes. If I don't open my mouth, you will not see what is happening in my mouth.
Exactly.
Do you understand?
Exactly.
So I guess that is what is happening. But we need to go beyond that and know that we need to take care of what is happening in that mouth, because it is very, very important.
All right. Okay. So let's look at how to tackle all of these signs that you've talked about, because when it happens, there should be probably some solutions to that. We'll go on this very short breather. We're still on IKD 106.1 FM. When we come back from this short break, we have Dr. Kehinde in the studio who will do justice to the conversation. That is how to tackle all of this oral hygiene crisis, so to say. Don't touch that dial. When we return, you'll be hearing the voice of Dr. Kehinde. We'll be right back. Of course, it's still the issues, and today we focus on dental health and oral hygiene practices. With me in the studio, I have Dr. Kehinde Osinaike, who happens to be the consultant family dentist from General Hospital Ikorodu. And this is another way to say a very big thank you to General Hospital Ikorodu for always being available and always being there for us here at IKD 106.1 FM. So I come back to you, Dr. Kehinde. How do we tackle all of this crisis when we talk about oral hygiene? Crises such as the signs of bad breath, and there are some other names that you mentioned that I can't even put together. So how do we deal with all of this crisis when we take that from your professional angle this afternoon?
Okay, thank you. So
Yes.
the first thing is, which we've heard and we've heard over and over again, and I would like to emphasize, is you need to brush twice a day.
Twice a day?
Yes. Morning and night. And when you have brushed at night, you must not take any other thing but water. Why do we say brush twice a day? So let me start with brushing at night. If, for example, if you brushed in the morning, all the food that you have eaten during the day, remember I spoke about bacteria in our mouth. If you don't brush at night, you are leaving enough food. They are going to have a failed day
to feed on.
And remember that when we're asleep, our saliva is not flowing as much as it is during the day. And so you don't have that washing effect of the saliva. And so the bacteria have a field day. So that's why we say brush twice a day. The night is very important. The morning is very important. And don't just brush. Brush with a fluoride containing toothpaste.
Okay.
In this side of the world, we don't have many places where we can get fluoride from. But toothpaste is one of the places where we can get our fluoride from. And so we advise for you to use fluoride containing toothpaste, because the fluoride in that toothpaste strengthens our teeth.
Okay.
So you must use a fluoride containing toothpaste. And then you must floss. There's something we call dental floss. So you have the spaces in between your teeth. When you eat, you find out that sometimes you have meat stuck in there. And so we don't advocate for you to use toothpick.
Wow.
We advocate for you to use dental floss. Why? The toothpick is sharp. And when you use your toothpick, you are poking at the ligament. Remember I told you, you have some parts of your tooth that are inside the gum. And for some of us, we enjoy it so much, we are winding it, and then the place starts bleeding. You know, so with the toothpick, you're actually doing harm and damage to the deeper structures of your tooth. So we don't advise you to use a toothpick. We rather advise you to use a dental floss. A dental floss is that thread that you use. You know, you just put it in between your teeth and it brings out whatever is there. We also advise you avoid taking too many sugary things. Rather than that, try and get your fruits, your fibrous fruits, your carrots and all. Why do we advise things like carrots? Remember I spoke about the surfaces of your teeth. When you eat things like carrots, the carrots are actually hard enough to remove some of the sticky things that you have eaten. So you have that. And of course, we advise you to visit your dentist. Okay. You must visit your dentist minimum of twice a year. For some patients, by the time we see them, we realize that the condition in their mouth is not so good. So we actually advise them to visit the dentist more than twice a year, but minimum twice a year. And change your toothbrush every 3 months. Change your toothbrush every 3 months, or change your toothbrush when the bristles have become splayed, when the bristles have begun to open up. Okay. So if whichever one comes first, if the bristles of your brush have become open up, then you change before 3 months. But if not, you must change your toothbrush.
But some people will just tell you that my toothbrush is still looking okay. I have people who will use toothbrush for 6 months.
Exactly. But that is wrong. You should actually change your toothbrush every 3 months, or when the bristles have become splayed.
Okay. I think we learn every day anyways. 0904081161 is the phone line. 0904081161. I'll take in just 1 or 2 questions from our listeners out there, where you can also ask questions directly to Dr. Kehinde. So when you talk about all of this, I'll take this message. This one is coming up, and okay, before that, let's take this call. Hello to you. Good afternoon. Hello, good afternoon. Hello, good afternoon. Your name and where you calling us from quickly. Okay.
Thank you. Good afternoon, sir.
I have a couple of questions, or let me just say 2 questions. The first question is, growing up, mother and them used to use salt to brush our teeth. If by pension we run out of mouth washers. Now the question is it good or ideal for somebody to be using soap to brush their teeth?
Did you say soap?
Salt.
Oh, salt. No, okay. You cannot use salt to wash your teeth. But I know also in the olden days, we used to use a lot of chewing stick. And there are actually quite a number of chewing sticks that are still good. We have the Oriata. Oriata is quite good. But the thing is that what we have realized is that people use them. You know that those chewing sticks are very hard. You know, and so in the process of trying to use it, you actually traumatize your gums. So except you can make the end of the chewing stick very soft before you start using it. But no salt, no, I don't advise that, because salt does not contain, except your salt is fluoridated. But really, we don't advise you to use salt. Just use your toothpaste.
nasal as well.
Yeah.
Then the second question is that some people normally have holes in their teeth.
Yeah.
Holes. How can this be prevented? How can it be controlled or taken care of? Those
Okay.
are the two
Okay,
questions
yes,
I have.
All right.
I spoke about that.
Yeah, thank you very much. Your question will be attended to. Thank you so very much. Okay, so doctor, you could just quickly
Okay,
attend to
so
that.
I spoke about that. The holes come about when we leave food debris in our mouth, and the bacteria in our mouth eat on this food debris and produce acids. So it is the acids that actually destroy.
Sorry, let's take this call. Hello, good afternoon.
Good afternoon.
Your name and where you're calling us from, real quick.
My name is David Ale.
Okay, Mr. David, your question.
I want to talk to the doctor.
She can hear you.
I'm here, sir.
My doctor, well done.
Thank you, sir. Good afternoon.
Well done. The question I want to ask you is that what are the causes for gum to be swelling at times, and after 3 days, the thing comes down again? What are the solutions and what are the causes? That's my question.
Okay.
All right, thank you very much. Okay, doctor, we could attend to that one real quick.
This one
Yes.
or the other one?
Yes.
Ready?
No, you finish up with the other one
Okay.
and then we dive into this.
All right. So as I was saying, so the acids that are produced in the mouth are what causes those holes. And once you begin to have holes, first of all, you just have the hole there. You don't have any pain, you don't have anything. But by the time you now start having pain, that means it is going beyond the crown and it is going into the pulp. If you remember our biology, that's where you have your nerves and your blood vessels. So once you start having pain from your tooth, then you know that you're in trouble. So to avoid this, as I said, you must brush morning and night, and you must visit the dentist. Whether you have pain or you don't have pain, you must visit us for your regular dental checkup and your regular cleaning, which is called scaling and polishing. Because the scaling and polishing, the tips of what we use are thin enough to go in between your teeth to remove all those debris that are there. All right?
Yes.
Then for the second question, we also spoke about is the same thing. You have food that has accumulated in your mouth. You don't brush very well. And so it gets there and then it now forms what we call plaque, bacterial plaque. That means your food in conjunction with the bacteria.
Okay.
And then it forms a layer. If you look at some people's teeth, you find out that the place is looking yellowish.
Yeah.
It's not, yes. So now what that does is that it's irritating the gums. And once the gums are irritated, the only way the gum can tell you is you are disturbing me is for it to start bleeding.
Wow.
And so the gums just start bleeding, and that's called gingivitis. What is gingivitis? Inflammation of the gum. And what happens during inflammation? Apart from bleeding, you also have swelling. And so that's why I said it is abnormal for you to be brushing and you are bleeding. Once you are bleeding while brushing, you must visit the dentist. Now, for the swelling as well, there are some drugs that cause swelling of the gums. There are some drugs that we use for depression. There are some drugs that we use for hypertension. If you are not on any of these drugs and some other drugs and you are having swollen gums, you need to visit the dentist.
So some drugs could actually affect the gum.
Yes, that's the side effect of the drug.
Wow.
Yes.
Wow. Okay, I think this question has been attended to, but I would still like to read this out for Lovelyn from Adamo. The question has been attended to, but the summary of this question, she is asking that she brushes her teeth every morning and at night, and yet when she splits out, she discovers this blood particles. But I think that has been attended to. Okay.
So it's not just in the brushing, it's also the technique. There's some people that when you see them brushing, you would think they are washing a gutter. You're not supposed to brush your teeth like that. You're supposed to brush your teeth away. So your brush should be starting from your gum. So you are brushing your teeth away from your gum down to your tooth. Why? So for the upper tooth, you are brushing your teeth downwards. What does that do? If there is anything in between your teeth, the brush is going to bring it out. And for your lower teeth, you are brushing your teeth upwards. So you don't brush side to side. So your brushing technique can also be the reason why, even though you are brushing morning and night, you are still having those issues. And so that's why we tell you, when you come to the dentist, those are the things that we will teach you. So it's not just in you brushing side to side and brushing. And then also, what is the texture of the brush that you are using? You should not be using a hard brush. A hard brush is for those that have artificial teeth. So you should use either a soft or a medium brush. You know, so those are the things that can also cause. So it's not just in brushing, oh, I'm brushing morning and night. What is the technique? What type of brush are you using? So,
all right, thank you very much. You've heard Dr. Kehinde. Brushing is not suicidal. You don't have to kill yourself while brushing. It is not a war. So please, you need to calm down, take it easy. Perhaps get a softer brush or at least a medium kind of fair brush. Let's look at. We're signing out. Our time is fast spent already. But I'll still come back to you. Your medical advice now to listeners out there, those that can hear you. I don't know if you can still take one of these calls, but your medical advice to persons out there that can hear you as a consultant when we talk about family dentist.
so my advice to the listeners is visit the dentist at least twice a year. Do not come when you have pain. It's better for you to come and let us tell you that these are the things that we see in your mouth than for you to wait until you have pain. So visit the dentist twice a year minimum. Change your toothbrush every 3 months, or when the bristles have become splayed. Use a dental floss and don't use toothpick, and use a fluoride containing toothpaste.
All right. Okay. Thank you so very much. Let's take this last message, please. I beg of you. I think this is important. This person is asking, is it also advisable, Kunle, is it also advisable for persons that are very old to still use toothbrushes?
Oh, yes. Once you have teeth in your mouth, as long as you have teeth in your mouth, you should use a toothbrush. And so I would also want to talk to the mothers of little children. So you have a child, immediately the first tooth comes out, you must start brushing that child's mouth.
Wow.
Immediately the first tooth comes out. Of course, we have toothbrushes of different sizes.
True.
So you get the size that is adequate for that child. But immediately the first tooth comes out, you must start brushing that child's mouth.
All right. Thank you very much. This is how far we can go on the issues today. I must tell you that I enjoyed every bit of the conversation. At the same time, I learned so much. I've penned down quite a number of stuff. You heard it from Dr. Kehinde that the mouth is the mirror of the body. At the same time, the mouth is the gateway to the body. This is very key. This is important. You should always take note of that. Do not take your mouth for granted. It is very important. Keeping our mouth clean, of free from diseases and all, is very, very important. My name still remains the same, Adebambo Opayemi. Tomorrow is another very good day. I must tell you, 25th of March. Do not forget to join us on the issues. Dr. Kehinde Osinaike, I say thank you so very much for being part of this.
Thank you very much. Thank you for having me.
And I'm saying thank you to General Hospital Ikorodu. Please pass my message across to the GM and every other person. That from IKD 106.1 FM, we love you all.
We love you too. Thank you.
Please have a nice day. It's a bye for now from our studio.